Brazil has recorded the world's second deadliest outbreak of COVID-19.
Around 4,000 deaths are being registered each day in India.
Now, health experts fear so-called vaccine hesitancy is slowing rollouts across the continent.
The Health Ministry also revealed that there are no more districts categorized as green zones in the peninsula.
Since the outbreak of the pandemic, the World Health Organization has flagged 4 COVID-19 mutated variants for scrutiny. They are B.1.1.7 that was first identified in the United Kingdom in the September of 2020, B.1.351 that was first identified in South Africa in May 2020, B.1.1.281 or known as P1 that was first detected in November 2020 in travelers from Brazil, and B.1.617 that was first detected in India in the October of 2020. There have been talks that these variants are more dangerous than the supposed original COVID-19 because they are more infectious and even vaccine resistant. More worryingly, 3 out of these 4 variants are already found circulating in the Malaysian population. A variant of concern is the middle ground between a variant of interest and a variant of high consequence. A variant of interest is identified when a cluster of new infections is detected with a mutated variant of COVID. A variant of concern is when a virus spreads rapidly in population, and a variant of high consequence is when there's a variant that's spreading that has a significant resistance to medical countermeasures, including vaccines. I sat down with Azrul Mohd Khalib, the Chief Executive of the Galen Centre for Health and Social Policy, to see if he could help me wrap my head around these various flavors of COVID-19. Azrul, let's get straight into it, okay? If B.1.617 is a variant of concern, is there any truth to the stories and reports that we are hearing lately saying that this variant is more resistant to the vaccine?
Well, those reports are generally wrong or premature. The main concern regarding these variants is whether the virus will find ways to remain elusive, potentially circumventing existing vaccines. So that's the main concern. So we have to ask the question is, how transmissible is the variant? Can it cause a different level of disease? Can it be detected through testing? How does it respond to treatments? Can it be blocked by vaccines or by natural immunity acquired through infections? So what researchers have discovered so far and to date is that B.1.617 may actually have increased transmissibility. So it's more virulent compared to the previous variants. Though preliminary evidence suggests that it is more transmissible or more virulent, there is currently no evidence that the B.1.617 variant causes more severe deaths, more severe disease or increased deaths. Any suggestion that you may have heard concluding that it has caused more deaths is premature, as there is no evidence to indicate that at the moment. We've seen laboratory studies of the B.1.617 variant, which suggest a limited reduction in neutralization, which could mean that vaccines become less effective. But what we've seen is from real-world evidence, which has been very positive on this aspect. What we have seen in other countries, in fact, is that the Pfizer and AstraZeneca vaccines appear to maintain its protection against B.1.617, while there's been some news from Indonesia, which seems to indicate the same for the Sinovac vaccine. And these are 3 of the vaccines that we currently have approved for use in Malaysia. So what we can say is that these vaccines are able to create a breadth of antibodies that target these variants, that they are still working very well at protecting people against serious disease and death.
Well, Azrul, as you know, getting people to come forward to get a needle in their arm is already difficult enough, but what about those who have perhaps changed their mind regarding vaccination altogether and then decided that it's not for them since it doesn't seem to be effective against these variants that are going around?
Well, if you're vaccinated with any of the vaccines that are currently available in Malaysia through PEG, namely the Pfizer, Sinovac, and AstraZeneca vaccines, you're going to have a pretty decent level of protection against the B.1.617 variant, as well as others which have already been circulating in Malaysia. We have to remember that there's more than one variant in Malaysia. We've already seen the South African and the UK variants, namely B.1.351 and B.1.1.7 variants in Malaysia. Without vaccination, you have no protection, no ability to reduce your chances of falling seriously ill and risk infecting others, including your family and loved ones. You will be depending on luck and your body's immune system to fight it out. And don't forget that almost 80% of current cases are asymptomatic, without symptoms. And here's the thing, it is currently known that no single variant circulating globally today seems capable of escaping fully the immune responses induced by vaccines. So we know that vaccines work against COVID-19. So there should be no reason for you not to get vaccinated.
There are 3 vaccines approved for use in Malaysia at the time of recording: Pfizer-BioNTech, AstraZeneca and Sinovac. Laboratory tests found that antibodies induced by various vaccines have reduced potency against B1617. In the meantime, AstraZeneca is working on a vaccine that they claim could work against all variants and is estimated to be ready in late 2021, while studies on Pfizer and Sinovac have shown that they still do provide some degree of protection against B1617 among other variants, including B1351 and P1. Limited testing has revealed some disappointing results too, such as a trial in South Africa showing that the AstraZeneca jab could only be just 10.4% effective against B1351 infections, which played a role in South Africa abandoning their use of the AstraZeneca vaccine. All 3 of the vaccines in Malaysia require 2 doses. While the vaccination will not be able to provide its full protection until some time after the 2nd dose is administered, the first shot still does provide some basic protection, and some protection is better than none at all.
That is one of the reasons why vaccinating as many people as possible is a priority. So one suggestion, though, that we could put forward as a recommendation to the government is that the PIC strategy should concentrate on getting as many people vaccinated with at least 1 dose, even if it means delaying the 2nd dose.
Vaccination, even if it's a little less effective than desired, is our way to beat COVID-19 and the variants that it brings along. If you notice, I've made it a point in this video to refer to this particular variant as B1617, and there is a reason why you should too.
You know, one thing we've learned from the very beginning for not just this virus, but every other virus that's ever existed is that these viruses do not respect or own one particular ethnicity or nationality. There is no such thing as a Chinese virus, Japanese, Batsaleh, or Indian variants. There really is no place for discrimination, racism, or xenophobia in this public health emergency. You know, one of the ways that we can help to deconstruct or prevent the stigma or discrimination is to actually use the term, the B1617 variant, rather than, describing it as the Indian variant, which helps to deconstruct mindsets. Because at the end of the day, these variants are going to be going around the globe, and obviously you're not going to have to name them according to where they came from. It's going to have to be named by what the scientific term or nomenclature is going to be. So call it the B1617, not the Indian variant.
Then should we be worried about India? Could there be a ripple effect that could come and haunt us here at home?
What is happening in India is unfortunately a cautionary example of why we should not be complacent or let our guard down. However optimistic the data projections seem to tell us, as you have seen in India and also several other countries around the world, and even in the UK right now, the situation can change very, very quickly. Today, constant vigilance is going to have to be the mantra that we live by, and not just depend on the government to protect us. A lot of people have been criticizing the government of flip-flopping. I think Chacha Marba is even being used as a way to describe, the different policies that seem to change quite frequently. But the way I see it is that shows adaptability, that shows flexibility, and responding quickly to what the evidence and science is telling us. We don't want to be mired in, rigid mindsets on how we should respond as opposed to what the science is telling us. So we need to be able to respond quickly to help prevent the spread, but also protect the people. And I think we sometimes haven't done enough of that, of protecting the people from the disease itself, but also protecting the people's well-being. So what we're seeing in India is not just India's problem. We need to be able to learn from what's happening over there in terms of how we should respond.
Though we may not directly feel the effects of India's poor management of the outbreak, we cannot let our guard down simply because we think we are better than them.
Definitely. One of the concerns that we've had right now is when you look at what's happening in India, the concern is that it could also happen here. And it's true, it could happen here. But the fact of it remains that in India, you had political rallies, you had religious gatherings, hundreds and thousands of people, which is basically responsible for having such an effect onto the way the Indian epidemic is. And it's a cautionary tale for those politicians who seem to be itchy to have a general election, or people who seem to think that God will protect you. Don't worry, you can go for Friday prayers, full capacity mosque and so forth, or go to temple. You don't have to worry. All of these are lessons to learn from, and we don't have to make the same mistakes. We can prevent what's happening there happening here, and it's important that we realize that Malaysia is not a special country that is protected from all these things. It can happen too in this country.
Well, thank you very much, Azrul. It's been a pleasure. As has been said many times by journalists, politicians, and even the health DG himself, we have not won this war yet. Kita belum menang. With the vaccine rollout underway, a glimpse of hope is on the horizon, but that is no reason to let your guard down. It is important that we all get vaccinated because herd immunity is the next big step towards the end of this pandemic. After all, that is what it means to say, kita jaga kita.